cold-related injuries. So risk factors are pretty much the same as with heat-related illness. So who were at risk for heat-related illness? Athletes, utility workers, old people, homeless people, mental health patients, yeah, dementia patients, because they're not aware of the environment, right? So you can add their IV drug abusers, okay, so polysubstance abusers, okay, because they have a mental impairment and then now they're exposed to the elements. So same exact risk factors for frostbite. So we'll just do the reverse. So instead of summer sports, these are now winter sports enthusiasts. So who are snowboarders here? Those that frequent ski mountains? No? They're all New Yorkers. Nobody does that anymore. Probably because there's no more snow. We haven't seen snow lately. Anyway, frostbite. So this is similar to burns. So the thermal injuries, we understand can cause burns. So can sub-zero temperatures. Okay, so this is now the other extreme. So too hot, this one is also too cold. This can cause the same burn injuries. They look a little different though, but the classification would be similar to burns, wherein we had superficial, right? Yeah, we had superficial thickness to partial thickness, same thing here. So we've got first degree, which is partial thickness, redness, erythema, to all the way to fourth degree, full depth destruction. When we say frostbite, though, this is really frozen extremity. So no blood flow whatsoever because the blood vessels are so constricted, it stops blood flow. The blood literally is frozen. So therefore, no blood flow, no oxygen flow, the extremity dies. So it appears hard, cold, insensitive to touch. They can't feel it anymore. Looks white or mottled blue white because there's no blood flow to that or to that body part. So body areas that are extremely sensitive to frostbite are, okay, so the hands and feet, followed by the body parts that are made of cartilage. Start with your nose, your ears, your lips, okay? Management. So how do you help someone with frostbite? Our goal is to restore normal body temperature because of course if that exposed body part was frostbitten, that means was the body also exposed to hypothermia? Yes. Okay. Uh, so our first aid would be we remove clothing and jewelry that are constricted. We remove wet clothing that will keep the patient hypothermic. Rule is if we're outside, which is usually the case, let's say what I mean outside is outside, we're outside the city. So are we ever anywhere near a medical facility, a hospital? Okay, if the patient is nowhere near, reasonably near a medical facility, then we do not want to attempt rewarming. Don't bother. Because if you rewarm and then you transport the patient, can they be exposed to another frostbite? Yes. So if that's the case, then don't bother. But if we have an ambulance, go ahead and start rewarming. Okay. But if it's just a private vehicle, especially if a pickup truck, for instance, then don't bother. All right, because once you thaw a frostbitten area and then it refreezes again, forget about it. That body part is gone. You can't just like steak. When you have steak, let's say you bought a little too much steak because it was on sale, so you end up freezing the rest, right? I'm gonna save it for another day. And then you thawed it, and then here comes somebody. Oh, they brought food. Now you refreeze the steak. So what happens to that steak? it's gone. It's ruined, right? Because it was already frozen, and then you thought you're supposed to eat it. Now you refroze it. Now the steak is ruined. You can't eat it anymore, right? So same idea here. Once you're in a medical facility, hospital, controlled rapid warming is started. So the temperature is as high as 104, the water temperature. That's hot, right? 104 degrees is hot, but not boiling hot. So it's a hot water bath. You dip one body part at a time, or if you have a bathtub in your facility, then we immerse the patient's body in there. However, we try to limit it to the frostbitten body part only. I mean, there's no sense putting the rest of the body in there, correct? Right. So we continue this until um, circulation is restored. How do you know circulation is restored? How do you assess? Pulses, right? Okay, so you check for pulse, you feel a pulse. Okay, good. We have circulation again.
For this one, the temperature will drop to how much?
80s, yeah. Oh, I forgot to mention, prior to rewarming, please make sure you administer IV pain medication to the patient, give them narcotics. It is painful, okay, to thaw a frostbitten body part. And do not massage because you will cause further tissue injury. And as I mentioned, once rewarmed, do not expose it to further injury, like refreezing it. We separate if it's the fingers and toes, make sure you don't let them stick. Okay, so you don't bandage the whole hand, you bandage each digit separately. Okay, so that they don't stick together. Okay. So if you watch for other injuries, like dehydration, for instance, or if this patient is drunk, hyperkalemia again, watch for and manage hyperkalemia, or it could be also hypokalemia, whichever the patient's condition was prior to the injury. These are deep wounds, so just like in fever, we give tetanus injections as well. And here are other interventions. So the whirlpool bath, again, 104 degrees Fahrenheit temperature. Just like in burns, if there are necrotic tissues and escharotomy may have to be performed to restore circulation to the muscles. Or if it's that deep, then it'll be fasciotomy. You remember escharotomy, right? Now, when we cut through the eschar in the burn, so same thing. And if they survive, what do we tell them? Don't do it again. Okay, so please stay indoors. If you're gonna drink, okay, drink indoors. Okay, don't drink outdoors. A last topic is for environmental emergencies. Last topic is hypothermia. So your core body temperature here is 95 degrees or less. It's easy to get this. You could just be in a hospital. Hospitals are cold, correct? Or in the OR, for instance. So that's why it's one of the post-op complications, hypothermia. Or just in where we're getting cold days now. We're hitting 50 degrees also. So same, again, risk factors, those who have, too much alcohol or too much drugs, for instance, dementia. Okay, so whatever impaired the patient's cognition, caused them to be exposed to the cold. For first aid, really no different from frostbite. But let's go now to the principle of rewarming. Because here, when we say hypothermia, that means it's the entire body. Yeah. This may accompany, of course, frostbite. So if a patient has frostbite, that means they have hypothermia. But let's say they have no frostbite, just simply hypothermia. There's a principle we follow here, especially if the patient goes into cardiac arrest, because when your temperature reaches below 94, you're at 93, 92, patients usually go into cardiac arrest. So therefore, what's your intervention? CPR, right? Chest compressions. Okay. When the patient's temperature remains hypothermic, meaning below 95 degrees Fahrenheit, we continue CPR beyond the normal duration. What's the maximum CPR we usually do before we give up? About 30, right? Yeah, 30 minutes, that's too long. Okay. So if the patient is hypothermic though, we continue beyond 30 minutes. The reason is you can't declare them dead at 95 degrees Fahrenheit. The patient's core body temperature must be above 95 before before you can declare them dead. Okay, so you're not dead until you're warm and dead. Does that make sense? No, that's true. That's what they say. So if there's a hypothermic cardiac arrest, we extend the CPR period. Do we understand that? Okay, so that's one exception to the rule. Okay, so we continue. Because in a way, later when you study ACLS, one of the interventions we'll do in cardiac arrest in the ICU is we induce hypothermia because we believe that if we drop the patient's body temperature, the heart is preserved. Okay, so that's one interventions we keep in mind. So the principle here, if again we have a cardiac arrest for a hypothermic patient, what do? Extend the chest compressions. Okay, there's still a chance, right? The heart is still could still be alive, right? Just like in frostbite, so remove anything wet because that will just worsen the hypothermia. So take them off and then replace them with warm clothes. Okay, so we discussed about the CPR. Okay, the rewarming procedure. Now the principle we use here is um, of course, the patient is rewarmed internally as well. So similar to what we did with the malignant hypothermia, wherein what did we do to the IV bag? We wrapped it in ice. Okay, so this one will be opposite. So now we wrap it in what? Fire? What do we do? Okay, hot packs. Okay, so we wrap the bag. Do we microwave the bag? No, of course not. Okay, so we put hot packs around. We warm the IV fluids. Okay. Now the principle here, we do the same. We put no, we put warm fluids into the stomach, into the bladder, and also into the rectum. Now the principle why we do internal cooling is to warm the trunk. The principle we use is we try to prevent after drop. After drop means, I think it's mentioned here. Right here. This after drop concept. Here, can somebody read this, please? At cold black.
Tissues has high lactic acid level. As this blood returns to the core, it causes a significant drop in the core temperature, i.e. core temperature after drop, and can potentially cause cardiac arrhythmias and electrolyte disturbances.
Okay, so that's the rationale. So we try to warm the trunk first. Okay? That's why we put warm fluids into the stomach, into the bladder, into the rectum, right? So that's our priority. We warm the trunk. So we put warm packs here, warming blanket. I'm not saying we don't warm the extremities, but we prioritize the trunk because the reason is what happens again? Once the blood leaves a frozen extremity, it will, yeah, because if you warm the extremity first, then there will be after drop. Okay. And supportive care, cardiac support if needed, again, chest compressions if necessary, defibrillation. We already mentioned the warm IV fluids. And again, this patient will be in AKI as well, pre-renal AKI. So we put in a Foley. Any questions?